Hello and welcome to the Quality Insights overview of the Pennsylvania Pediatric Asthma Control Program Education Module. My name is Robina Montague. I'm a registered nurse and practice transformation specialist at Quality Insights. This is an overview of evidence-based information related to pediatric asthma management. This work is part of ongoing efforts in providing Pennsylvania health systems, federally qualified health centers, medical practices, schools, and community-based organizations with information to assist with improving pediatric asthma prevention and management of exacerbations, and is designed to support and supplement your current efforts. Quality Insights is a nonprofit organization focused on improving healthcare quality in the pursuit of better care, smarter spending, and healthier people. We participate in federal and state contracts to improve healthcare quality, such as our partnership with the Pennsylvania Department of Health. An important part of this work is providing no-cost assistance to eligible practices to improve individual patient care and overall population health. In support of improving patient care, this activity has been planned and implemented by Quality Insights and CAMC Institute for Academic Medicine. CAMC Institute for Academic Medicine is jointly accredited by the Accreditation Council for Continuing Medical Education, the Accreditation Council for Pharmacy Education, and the American Nurses Credentialing Center to provide continuing education for the healthcare team. Quality Insights nor I have no further disclosures. In order to submit for CEU, CME, it is expected that you read the module on the Quality Insights Improve website in addition to completing a survey. The links and information will be available at the end of this presentation. All of the content I will be reviewing is a summary of a printable resource produced in June 2022. You can find the downloadable PDF version of this module by visiting the Quality Insights Improve website, which is linked here as well as at the end of this presentation. Please keep in mind that the various resources in the module are not endorsed by Quality Insights, and the guidelines and recommendations referenced are to be used along with clinician judgment and based on individual patients' unique needs and circumstances. Should you have questions related to the content, my contact information will be available at the end of the presentation. After the presentation and module, the learner will be able to explain asthma severity assessment and categorization, describe key aspects of proactive asthma practice management, discuss how you can utilize your electronic health record to identify, monitor, and manage your patients living with asthma. Non-healthcare learners will learn more about the burden of pediatric asthma in Pennsylvania and have a broader understanding of how you can assist children living with asthma and make changes in your environment to help avoid triggers. Quality Insights has been contracted by the Pennsylvania Department of Health through a collaborative agreement and funding by CDC to work to improve the reach, quality, effectiveness, and sustainability of asthma control services, and to reduce asthma morbidity, mortality, and disparities by implementing evidence-based strategies across multiple sectors. Through the initiatives and goals of CDC controlling childhood asthma and reducing emergency C care, the Pennsylvania Department of Health and partners throughout the state have engaged in the Asthma Control Program and the Pennsylvania Asthma Partnership. The CDC objective is to prevent 500,000 visits to the emergency department, urgent care, and hospitalizations due to asthma by August 31st, 2024. The Exhale strategies provide context in how we as a community can support and help reduce exacerbation of asthma in children. Asthma is a chronic disease of the lungs that causes inflammation and swelling of the airways that results in narrowing of the airways and symptoms including trouble breathing, wheezing, coughing, and tightness or pain in the chest. Without proper management, asthma can result in frequent emergency department or urgent care visits, hospitalizations, and even premature death. There is no cure for asthma, but appropriate treatment prevents asthma attacks and can help patients have a better quality of life. Asthma is one of the most common and costly diseases in the United States. Asthma affects adults and children of all ages. In the module, there are resources to help identify triggers and also home remediation suggestions to help children with asthma. According to CDC, approximately 6.2 million United States children, adolescents, and young adults 21 and under have asthma. In 2019, non-Hispanic Black children had an asthma death rate 8 times that of non-Hispanic white children. In 2017, non-Hispanic Black children were 5 times more likely to be admitted to the hospital for asthma as compared to non-Hispanic white children. While all of the causes of asthma remain unclear, children exposed to secondhand tobacco smoke are at increased risk for acute lower respiratory tract infections such as bronchitis. Children living below or near the poverty level are more likely to have high levels of blood cotinine, a breakdown product of nicotine, than children living in higher income families. 1 in 8 children had lifetime asthma in Pennsylvania in 2019, with a higher prevalence in boys than in girls. By race and ethnicity, white non-Hispanic children had the lowest prevalence, 1 in 9. Black non-Hispanic children and Hispanic children was 1 in 6. Older children in Pennsylvania are more predominantly affected by asthma. In 2021, the states listed here were named as Pennsylvania asthma capitals by the Asthma and Allergy Foundation of America. This report analyzes 8 risk factors that can influence asthma outcomes, such as poverty, lack of health insurance, air pollution, pollen count, long-term controller medication use, quick relief medication use, smoke-free laws, and access to asthma specialists. Poverty, air pollution, and access to specialists are key factors for these cities. This is likely due to more industrial and urban populations. Asthma rates tend to be higher, especially among children in urban locations. The 2021 top asthma capital is Allentown, Pennsylvania, the midway point in the Northeast Mid-Atlantic asthma belt. Allentown's placement in the top spot is largely due to high rates of asthma-related emergency room visits. Compared to previous years, Allentown's asthma emergency room rate has been increasing steadily. The social circumstances in which people live, learn, work, and play can have a greater impact on health outcomes than health-related factors such as healthcare coverage and access to care. The Asthma Control Program will leverage new and existing partnerships to address the social determinants of health leading to asthma disparities in Pennsylvania. Multiple social determinants of health contribute to asthma disparities, such as low-income housing, low household income, environmental inequities such as outdoor air pollution and substandard housing, and living in poor communities. Also, exposure to pests, mold, air pollution, including second and third hand smoke, and high levels of stress due to community violence. Major barriers to healthcare access in poor communities include lack of adequate health insurance coverage, overwhelmed clinics, shortages of culturally and linguistically competent providers, and low health literacy. How can you make a difference in your medical practice? Assess asthma severity and categorize and diagnose to the highest level of specificity. Assess and monitor asthma control. Use inhaled corticosteroids on all persistent asthma patients. Use written asthma action plans on every patient with asthma. Assess for environmental exposures and triggers. Schedule follow-up appointments for exacerbations, medication changes, or upper respiratory tract infections. Initiate or continue a Call Us First initiative that includes contracting with pediatric asthma patients and their caregivers to call the office for an appointment when the patient is in the yellow zone of their asthma action plan and not responding to treatment. For red zone recommendations from the provider for at-home treatments, an in-office appointment, or referrals to urgent care or emergency room when necessary. Providers are available in your office 24 hours a day, 7 days a week. You can also provide asthma education or refer to an asthma self-management education program. Severity and classification of asthma. Severity is the intrinsic intensity of the disease process. Severity is most easily and directly measured in a patient who is not receiving long-term control therapy. Severity can be measured once asthma control is achieved by the step of care. For example, the amount of medication required to maintain control. Control is the degree to which the manifestation of asthma are minimized by therapeutic interventions and the goals of therapy are met. Asthma control test questions are utilized to determine the level of control and severity of the child's asthma, which allows providers to determine the best course of treatment. Everyone with asthma should have an asthma action plan in writing. This plan provides information and instructions on how the child and caregivers can manage asthma. It includes medications, recognizing when symptoms get worse, when to call the provider, and what to do in an emergency. In addition to sending the asthma action plan to the patient portal, encourage caregivers to take a picture on their smartphones, and they will have it with them at all times. Asthma action plans also tell school and other caregivers about the child's asthma. This could include teachers, school nurses, coaches, and after-school care staff. If the child you are working with does not have one, please request an asthma action plan for the child. Asthma control is the goal. Asthma is the most chronic health condition among school-age kids and one of the leading causes of absenteeism. Schools face many issues related to asthma, including responding to students in respiratory distress, decreased student and staff productivity, increased health office visits, and access to life-saving medicine. The Asthma Friendly Schools Initiative provides a framework and tools that communities and schools can use to work together on a comprehensive approach to asthma management, including planning tools, policy recommendations, and education programs. The American Lung Association has 2 programs aimed at asthma self-management and education. Open Airways for School is the most recognized asthma management program for children. The program teaches children 8 to 11 years old asthma self-management at a level they can understand. Children who take Open Airways for School can take steps to prevent symptoms. They learn to recognize triggers and feel more confident about taking care of their asthma. Kick-In Asthma is an asthma self-management education program for kids ages 11 to 16, predominantly in grades 6 through 10, that empowers them through fun and interactive approach to asthma self-management. Kick-In Asthma includes different learning techniques suitable for older children and highlights self-management practices, such as recognizing triggers and proper medication use. Consider supporting your local school district or school in starting an Open Airways for Schools or Kick-In Asthma program. Evidence shows interventions are effective when delivered by trained school staff, nurses, and health educators in elementary, middle, and high schools, serving diverse populations. This may be a perfect opportunity for high schoolers to meet volunteer hours that may be required for graduation by assisting in facilitating the program. Providers can get on board by supporting their local districts and promoting and referring to these asthma self-management education programs once they are established. CDC recommends the annual flu vaccine for children with asthma, as they are at higher risk for developing serious flu complications, even if their asthma is mild or their symptoms are well controlled by medication. Additionally, the COVID vaccine is recommended and should be promoted. On June 18th, the recommendations were expanded for emergency use authorization for children 6 months and older. Resources are available to provide parents and caregivers information to reduce childhood exposure to second and third-hand smoke. Second-hand or third-hand smoke can be a trigger for an asthma attack in a child. Third-hand smoke is the residue left behind on fabrics and persons that have smoked that can be a trigger for children with asthma. Children around smoke have worse and more frequent asthma attacks. More than 40% of children who go to the emergency room for asthma live with smokers. The PEA Free Quit Line is a telephone-based tobacco cessation counseling service that offers free coaching with no judgment for up to 5 sessions, free nicotine replacement therapy if medically eligible, and web-based and text-based messaging support. The phone number to access the PA Free Quit Line is 1-800-QUIT-NOW. The Community Preventative Services Task Force recommends team-based care to improve patients' asthma. Team-based care increases the proportion of patients with controlled asthma and is cost-effective. Pharmacists play a crucial role in reducing the risk for asthma exacerbations by promoting medication adherence. Refer to the learning module for resources and tools for care teams and pharmacists. Engaging schools, coaches, and other people in the child's life to better understand their asthma will help them keep their asthma in control. They are also a valuable part of the child's care team. Quality Insights was recently recognized for our successes as Healthy People 2030 champion. Healthy People 2030 recognizes that asthma is the most common chronic lung disease in children. Children under 5 years are more likely than other age groups to go to the emergency department because of asthma. Reducing environmental triggers, teaching caregivers about asthma, and making sure children get the right medications can help reduce emergency department visits for asthma for all children. Quality Insights can also be found on the web, on Twitter and LinkedIn. Here is my contact information. Feel free to reach out to me if you have any questions or concerns or more interest in the asthma control program in Pennsylvania. If you have any problems completing the survey or getting the link for your CMEs or CEUs, please feel free to reach out to me. I invite you to visit the Quality Insights website linked above to download and review all of the available information for this module. Quality Insights also provides a free e-bulletin that features regular updates and resources for pediatric asthma management. Please email me to be added to the distribution list. Please be sure to read the module on the Quality Insights Improved website under PA Pediatric Asthma Control Program to complete your participation for the continuing education credits, and complete the survey and provide feedback on the webinar. Thank you very much for taking the time to view this recorded webinar, and I hope you have a great day.